One more day to go until patio season officially begins here in Ontario. With step one of reopening on the horizon, some cautious optimism coming out of Peel region. While case counts are the lowest this hotspot has seen since last fall, the Delta variant is gaining steam, and this has the region's mayors and top doctor pushing the province even harder to get essential workers fully vaccinated.
As long as we can contain this Delta variant, we're not going to worry about a spread beyond.
Case counts are drastically falling here in Brampton. This week, the test positivity rate is 7%, with 73 cases per 100,000 residents. Those are the lowest numbers in at least 8 months. But here's a concern. Up to 35% of new cases are the Delta variant, and it's on track to becoming the dominant strain in Peel in the coming weeks. And the region's top doctor says people with one dose are getting infected.
I can confirm that there's just under 10% of the Delta variant cases that we have identified were partially vaccinated. We do need to actually look at further information to identify whether they acquired the infection during the initial period after their vaccination, where they may not have been fully protected. And the science shows that only 33 to 50% protection is afforded against the Delta variant with one dose.
Peel region is asking for two things: more supply and a lower eligibility so essential workers can get fully vaccinated as soon as possible.
There's ongoing conversations with the province. They're certainly aware of our sentiments in Peel. We haven't had a response yet that we like.
And on Monday, Health Minister Christine Elliott told CityNews that accelerating second doses in hotspots is not necessary.
Our medical experts have confirmed to us that while we know that the Delta variant is out there and has expanded significantly, they don't believe it's going to put us at risk of a fourth wave.
U of T epidemiologist Ashley Chute contributes to provincial modeling and disagrees with the current approach.
At this point, is our vaccine rollout good enough that we don't need to worry about the Delta variant possibly sparking a fourth wave?
I think the challenge with that statement is that, we have limited capacity in terms of how quickly we can roll out vaccines. And with a communicable disease such as COVID-19, we know that once it starts growing, it grows exponentially. Redirecting those vaccines to these hotspots is going to benefit everybody because it's going to allow us to get through the summer and enter the fall in a very different place.
This virus isn't equal. It treats a rural setting differently than it does a densely urban populated area. I would have assumed we would have learned these lessons in the last wave, but we're having this discussion again, unfortunately.
Well, so far, Peel region has administered 1.2 million vaccines, with 74% of residents 18 and older having at least one shot in the arm. But at this point, second dose coverage remains very low.